So like we mentioned before, your cholesterol levels are a little bit high, as well as your glucose. So, and do you have any questions for me at this point?
Not right now.
Not right now. So your next visit, before you leave today, I'm gonna ask you, do you have any food groups that you avoid?
Yes, dairy.
Dairy.
Lactose, yes.
Okay. Are you lactose intolerant?
Yes, I am lactose intolerant.
Okay. So I already want to go ahead and document it that you have hypertension, diabetes, and you are lactose intolerant, right? Okay. So on your next visit, I'm going to have a menu for you. And here I'm going to be giving you a diary where you can document your feelings, the times that you eat. Do you usually have, what times do you more or less have your meals? Or do you have your 3 meals and snacks? What is it that you have more or less?
Sometimes it's like I like eat at one time and then another
time.
Yes, and I never have like a specific times. It's whenever I can, and then I don't follow like a specific regimen.
Okay, so make sure you document all this information here, and make sure you also document your glucose, because I would like to see how your glucose is doing also. And so document your glucose, also document your feelings, the way, and it would explain you on here also. It would tell you, the times that you eat, what you eat, what is your attitude at the time, or how are you feeling at that time. Who are you eating your foods with, alone, with a friend, with your family, and things like that. So make sure you document that for 5 days. I'll see you next week, and I'm going to be having your menu. I am glad that you came to me, and if I can help you in anything, don't hesitate. You have my number, you have my card. So go ahead and call me if you have any questions, so I can go ahead and help you. So I'll see you next week.
Okay.
Then
see you next week. At what time?
At what time? You can be here at 10 in the morning next week. So we're gonna go ahead and do that, okay? By the time I'm gonna be having your meal and your pattern, and we're gonna I'm gonna try to help you to identify how can we cope with those feelings that you're having, that stress with your job, with your family members, especially because you mentioned that you did have some problems with your family members, with your budget and things that we can see that the way I can help you to cope with all these feelings, and do not try to food to comfort you. Do you realize that you do have a condition that is affecting your health? Because it seems that it already affected your health. So right now what I'm trying to do, I'm trying to reverse a little bit of all those years that you say you started dieting back in the 80s, right? So I'm trying to, and I'm glad you did realize, that there is some problems also with with dieting, all those diets about they show on TV and things like that. I'm glad that you came to me so I can go ahead and help you with your condition. Okay. Thank you, and I will see you next week. Okay. Thank you.